So let's bring in Dr. Tasha Dixon. She's the family medicine lead physician at Martin Luther King Jr. Outpatient Center in Los Angeles. Doctor, so great to have you. Let me ask you about this. We were just talking about children and schools. In an interview earlier this month, the Education Secretary, Betsy DeVos, claimed that children are, quote, stoppers of COVID-19. I've never heard that before. And yesterday, President Trump said this. Take a listen.
They don't catch it easily, they don't bring it home easily, and if they do catch it, they get better fast. They're very impressive. They have very strong immune systems.
Yeah, we know children have strong immune systems, but with the opening of schools, the reopening of schools, and this internal CDC memo that says nationwide COVID-19 cases in children are rising, how concerned are you? Have you heard that children are stoppers of COVID-19?
I actually haven't heard that. I tend to follow the science. I follow what CDC says, what the World Health Organization says. I hadn't heard that before. I will say that we are concerned about our children going back to school, knowing that children are being affected at higher rates than before. And we initially thought they were going to be asymptomatic, but they are becoming affected more often and more often than we expected.
I want to ask you about the situation where you are in California, which is now the new epicenter of the virus in this country, setting a single-day record for new cases. Now we're 6 months in. So my question is twofold. I want to know what you're experiencing there, but also, you know, I recall at the beginning of this pandemic when New York was the epicenter. And, you know, Vlad and I would look at the numbers in California and think, wow, how are they keeping their numbers so low? They have a massive population just like New York, but they managed to sort of get a handle on things. And now, 6 months later, we're seeing the opposite happen in California. So I want to get your take on what do you think happened in California? It seemed to have a government that was open to shutting things down, was you know, acknowledging the risks of this virus, not pretending like it wasn't existing like we saw in some other states. What happened in California?
Well, I won't speculate. What I will say is that we are working hard to provide care for our patients that are affected by COVID. I will say that our government has done the best that they can, and we work very, very hard in conjunction with them to provide care. I want to just add that it's important to know that we are caring for our patients here. In terms of, you had asked in regards to my experience here on the ground, we are on the front lines. We are providing care in our outpatient centers here and in hospitals and urgent cares. We're still open for services. We still have ICU beds and hospital beds available. We've got plans in place to provide care for the patients in California and for our citizens of California.
Let me ask you about this new deal by the Trump administration, which has secured 100 million doses of the Pfizer-BioNTech vaccine. Some experts say we shouldn't be pinning our hopes on a vaccine that works immediately and instead consider a more comprehensive approach. In your opinion, what would that look like?
So I hear the news and everything about the vaccine, and while the vaccine's very promising, my job here is to provide care and to really remind everybody that it's going to be very important for us to remember our social distancing and physical distancing and wearing face coverings and hand washing and hand hygiene. Let's continue to follow the science. Let's continue to see where research takes us with the vaccines, and let's be open to vaccines and to not be so hesitant to shy away from them. But let's focus on what we can do now as a whole, and that is remembering physical distancing, hand washing, and face coverings, and staying at home when you can.
All right, Dr. Dixon, thank you as always. We appreciate it.
My pleasure. Thank you.